Hello, and welcome to this brief video guide for patients undergoing minimally invasive total hip replacement surgery at Niagara Health. In this video, we will review how to prepare for your surgery and what to expect during your hospital stay and discharge home. This information is also covered in your pre-op education booklet. Please note that all information presented in this video relates to physiotherapy and occupational therapy protocols. This information is not intended to replace the medical advice of your doctor or healthcare provider. You will receive additional information during your pre-op appointment from other disciplines that is not covered in this video. We would like to share some important information you need to know before your surgery. A minimally invasive total hip replacement uses a direct anterior approach, which involves making an incision along the front of the pelvis. This does not require detaching any muscles or tendons. As a result, you have no movement restrictions or hip precautions. To ensure you are prepared for surgery, please complete the following tasks. Start an exercise program to help you get stronger. Arrange your household to keep important items within reach. Create a clear path in your home. Remove all electrical cords, throw rugs, and anything else that may cause you to trip and fall. Install nightlights to make it safe to move around at night. Rent or purchase a two-wheeled walker or rollator walker. You may want to consider installing grab bars, a shower chair, and/or a raised toilet seat in your bathroom, but these items are not required. Please note, some vendors are not open on weekends. It is important to obtain your walker prior to coming to hospital. Next, let's review the items that you need to bring with you to the hospital. Your Total Hip Replacement Minimally Invasive Anterior Approach Education Booklet. Your glasses, dentures, and hearing aids. Loose, stretchy clothing, for example, loose-fitting underwear, jogging pants, stretchy socks, and a loose top. Lightweight supportive shoes. No backless or poorly fitting slippers are allowed. Your walker, and please ensure it is labeled with your name. If your surgeon plans to have you stay overnight in hospital, consider bringing your medical devices, such as a CPAP machine, and personal items such as your toothbrush, toothpaste, and other grooming items. And please leave your valuables at home. After surgery, you will go home from the hospital once you meet the criteria for discharge. This will likely be the same day as your surgery. Please be sure to make arrangements ahead of time for someone to pick you up, take you home, and stay with you for a few days. After your surgery, you will be seen by the therapy team, which consists of a physiotherapist and an occupational therapist. The therapy team will review your weight-bearing status prior to discharge from hospital. Please note, unless otherwise told, you will be weight-bearing as tolerated. This means that you can put your full weight, or as much as you can tolerate, on your operated leg. The team will also review the following: exercises you will be expected to complete in hospital and at home. How to transfer and walk safely with your walker. This includes getting in and out of bed, chairs, and the car. How to navigate stairs. How to perform your daily activities like toileting, dressing, and bathing while you recover. And any additional equipment recommendations and energy conservation strategies. And finally, the majority of your recovery and rehab will take place at home. The following recommendations are important to support your successful healing. On discharge, ensure you are taking your medications as directed. Use your walker for safe mobility. Change positions frequently and avoid sitting for greater than 45 minutes at a time. This will reduce swelling and stiffness in the hip, and be sure to perform the recommended exercises. Keep your dressing or bandage clean and dry unless otherwise discussed with your surgeon. No showers, baths, or use of hot tubs, swimming pools, or saunas until discussed with your surgeon. Arrange to have your follow-up appointment 2 to 3 weeks after surgery or as ordered by your surgeon. If staples were used, they will be removed at the follow-up appointment. Ensure you have a physiotherapy appointment scheduled. This will either be at an outpatient clinic or through Anterior Health at home. If you are receiving physiotherapy through Anterior Health at home, the physiotherapist will visit you at your home. Do not drive or return to work until directed by your surgeon. And remember, you have no movement restrictions. Find a comfortable sleeping position, follow your weight-bearing instructions, complete your exercises, and use your walker. Thank you for taking this time to prepare for your surgery. If you have any questions, please let your inpatient therapy team know. And please be sure to refer to your Total Hip Replacement Minimally Invasive Anterior Approach education booklet for more details about the topics we reviewed in this video. Finally, on behalf of the whole Niagara Health team, we wish you a swift and smooth recovery from your surgery, with hopes for your health and well-being in the days ahead.